Hi, I'm Dr. Hess and I'm an ophthalmologist. One of the great things about eyesight is that it's measurable. This is important because checking vision accurately can help detect eye disease before it causes visual loss, and conversely, failing to check vision appropriately can and does lead to permanent visual loss in our community. For this reason, visual acuity is the vital sign in ophthalmology and an essential clinical skill for medical students, doctors, and other healthcare providers. Today, we'll demonstrate how to check visual acuity accurately and record your findings appropriately. Different sized eye charts are available for use at 6 meters, 4 meters, and 3 meters, depending on the size of your room or clinic. You'll need the patient's documentation, a pinhole occluder, box of tissues, and a hand sanitizing gel and sterile wipes. Ensure the chart's well illuminated with enough light in the room or a backlit chart like the one that we've got. Position the patient sitting or standing at the appropriate distance from the chart and let them know that you'll test one eye at a time. Ask the patient to wear their usual glasses for distance vision if they have these. Reading glasses should not be used. Ask the patient to gently cover one eye using an occluder or a tissue. Make sure they don't press on the eye because this can distort the vision. Ask the patient to read from the top of the chart from left to right. If the patient can't read letters, use the tumbling E chart, asking them to point in the direction of the legs of the E's. Move down the chart to the smallest line that the patient can see. Once the patient starts making errors or can't see the letters, stop on that line. The smallest line that the patient can read is their visual acuity for that eye. The level of vision is expressed as a fraction where the upper number refers to the distance of the chart from the patient. Usually this will be 6, and the lower number, which is usually written next to the line on the chart, is the distance at which a normal eye can read that line of the chart. On the other hand, 6/18 means that at 6 meters, the patient sees what a normal eye would see at 18 meters, which tells you that there's some visual impairment. Likewise, 6/60 means that at 6 meters, the patient sees what a normal eye would see at 60 meters. If the patient reads a line incompletely, this can be expressed by subtracting letters from the lower number. For example, 6/9 minus 2 means that the patient read the 6/9 line but missed 2 letters. If someone misses more than 2 letters on a line, then the vision is expressed as the previous complete line plus any letters that they saw on the next line. So for example, 6/12 plus 1 means that the patient saw all the letters on the 6/12 line plus 1 letter on the 6/9 line. If you're using a 3 or 4 meter chart, then the acuity is expressed as 3 over the smallest line that they can read or 4 over the smallest line. Alternatively, some charts have a 6 meter equivalent reading written on the side. If they don't, you can convert to a 6 meter equivalent by multiplying the top and bottom numbers by 2 for a 3 meter chart. So for example, 3/6 multiplied by 2 becomes 6/12. If you've got a 4 meter chart, you can multiply the top and bottom numbers by 1.5. So for example, 4/12 becomes 6/18. If the patient doesn't achieve 6/6 vision, then cover the eye with the pinhole occluder. This can be placed in front of their distance glasses if they wear these. The pinhole focuses the light entering the eye, and if the vision improves with pinhole, this indicates that glasses would improve the vision. If the patient can't read the largest letter on the chart, then move the patient to half the original distance from the chart and recheck the vision at this distance. So for example, the vision would be expressed as 3/60 if they could read the top letter at a distance of 3 meters from the chart. If the top letter can't be read at half the original distance from the chart, then hold your fingers up at 1 meter from the patient. This is recorded as counting fingers vision. If the patient can't count fingers, then wave your hand at 1 meter. This is recorded as hand movements vision. If they can't see hand movements, then shine a pen torch towards the eye. This is perception of light vision, and if they can't see the light, this is no perception of light. Once you've measured the visual acuity in one eye, repeat the procedure for the second eye. Summarize your findings in the patient notes for each eye, clearly stating whether the vision was unaided, so without glasses, or with the person's normal distance glasses, or with pinhole. Be encouraging. People don't like making mistakes, so if you encourage them along, they'll often get a few extra letters or sometimes even a whole extra line on the chart. So remember, visual acuity is the vital sign in eye care, and being able to check vision accurately might help you save someone's vision one day in the future.